Dr. Beck, and today is a very special episode. We are going to raise awareness for a special type of disease called AAT deficiency. Now, just to keep you guys informed and knowledgeable, we're going to show this quick little video right here.
Discovered by Dr. Laurel and Dr. Erickson in 1963, AAT deficiency is characterized by a lack of AAT protein in your body. In a healthy individual, AAT is produced by the cells in the liver, secreted into the bloodstream, and protects the lungs from the protease neutrophil elastase. Neutrophil elastase is produced by white blood cells to digest bacteria and damaged tissue in the lungs. In an individual with AAT deficiency, AAT is produced in the ER of the liver cells, but is misfolded and does not get secreted into the bloodstream. This protein builds up in the liver and becomes toxic. When AAT is not secreted into the blood, it is not present to regulate the activity of the neutrophil elastase in the lungs, which then attacks healthy tissue. This deficiency leaves the body vulnerable to conditions such as COPD, emphysema, and liver damage. The normal alpha-1 antitrypsin protein is synthesized in the ER, where it eventually gets packaged and secreted out by the hepatocytes. The protein will then travel to different organs, such as the lungs, where it inhibits neutrophil elastase. In the mutated version of AAT protein, it can no longer follow this pathway because it can't be secreted outside of the ER. This happens because the individual proteins aggregate and form bonds with each other. The accumulation of these proteins in the ER of hepatocytes leads to cirrhosis in the liver.
Today we have some very special guests with us today. We have a pulmonary specialist named Sarika. She's a doctor. We have a patient suffering from AAT deficiency, and a PhD candidate studying the biomechanisms of AAT deficiency. All right, so let's get this game started. Sarika, take your category.
Yeah, I'll take the basics for 100, please.
This is what AAT stands for.
What is alpha-1 antitrypsin?
That is correct. Pick the next category.
I will take the basics for 200.
This protein is inhibited by alpha-1 antitrypsin.
What is neutrophil elastase?
That is correct, Emma.
Okay, I'm going to take diseases for 100.
This is what neutrophil elastase does to the body.
What is makes strong bones and teeth?
No, that is incorrect. You're thinking of calcium.
So similar.
What is deterioration of alveoli in the lung?
That is correct.
I will go back to the basics for 300.
A mutation in this gene leads to AAT deficiency.
What is SERPINA1?
That is correct.
Woo. And I'm going to take basics for 400.
This is the dominance of the AAT mutation. Okay.
What is codominance?
That is correct. She is on the board.
I will take the basics for 500.
This amino acid substitution leads to the Z allele form of AAT deficiency. Aaron.
What is arginine?
No, that is Michaela.
Glutamic acid 342 to lysine.
Alpha-1 antitrypsin deficiency is a hereditary codominant disease. There are 3 gene copies of AAT. The normal allele is denoted as M, and its function is to protect alveoli from excess neutrophil elastase. S is the mild allele, which causes a reduced function of AAT, but produces enough to maintain its intended function and not increase much harm to the lungs. Z is a severe allele and causes severely reduced function of AAT. These 3 allele types can be inherited together in a codominant fashion. The combination of alleles determines the severity of the deficiency. MM is a healthy combination, whereas ZZ causes severe AAT deficiency.
All right, so now we're going to cut to a quick commercial break.
Smoking kills. And if you have AAT deficiency, you are already at an increased risk for lung disease. The alveoli in your lungs are deteriorating due to your body's insufficient levels of AAT protein, and smoking will dramatically intensify these detrimental effects.
And we're back. Michaela, pick a category.
I will take affected organelle for 100.
Organelle is affected in AAT deficiency.
What is the endoplasmic reticulum?
That is correct.
I will take affected organelle for 200.
These are the basic functions of the ER.
What is protein production, folding, and handling of misfolded protein? I will take affected organelle for 300.
This happens to the ER in individuals with AAT deficiency. Aaron.
What is misfolded AAT proteins collect in the ER?
That is correct. You are very knowledgeable.
I know. All right, Alex, I'm going to take affected organelle for 400.
This is the correct pathway that the AAT protein follows in healthy individuals. Aaron.
What is secretion via the Golgi into the bloodstream?
That is correct.
All right, I'm going to take affected organelle for 500, please.
What organ is affected when AAT is not secreted properly in the bloodstream?
What are the liver and the lungs?
That is correct. And we are going to take a quick word from our sponsors.
Brought to you by Prolastin. Prolastin is a synthetic substitute for the AAT protein used to treat those with AAT deficiency. Prolastin mimics the natural function of AAT by inhibiting neutrophil elastase and thus preventing damage to healthy alveolar tissue. Side effects may include, but are not limited to, chills, headache, rash, shortness of breath, bladder pain, cough, fever, nasal congestion, and rapid heartbeat.
And we're back. Michaela, pick a category.
I will take disease for 200.
Individuals with this AAT deficiency have an increased risk for these two diseases. Michaela.
What are liver disease and emphysema?
That is correct.
All right, I will go ahead and take disease for 300.
These are the major symptoms of AAT. Cerebral.
What is shortness of breath and liver disease?
Correct.
I will continue with disease for 400.
This percent of North American, North European population is estimated carriers of AAT deficiency.
What is 4%? All right, I'll go for the disease for 500.
AAT deficiency liver disease is the result of this kind of mutation. Aaron.
What is gain of function?
Correct. And we'll be back after this quick commercial break. And we are back to the game.
All right, Alex, I'm going to take current research for 100, please.
This animal is the model organism used to study alpha-1 antitrypsin deficiency. Michaela.
What are mice?
That is correct.
All right. 200, please.
This strategy has been used to prevent polymerization of faulty AAT proteins by designing peptides that target specific regions of the protein. Michaela.
What is immunohistochemistry?
No, that is incorrect.
What is structure-based drug development?
That is correct.
I will do current research for 300, Alex.
This master gene, when used in gene therapy, has cleared the ER of misfolded alpha-1 antitrypsin proteins by inducing autophagy.
What is transcription factor EB?
That is correct.
All right, I'll take 400.
This drug, currently in phase 2 and 3 of clinical trials, is known to induce autophagy, reducing the number of aggregated alpha-1 antitrypsin proteins.
What is carbamazepine?
That is correct. You are on a roll.
We'll finish it with 500.
This chemical chaperone, which facilitates the folding of multiple misfolded proteins, has shown to increase the secretion of misfolded AAT proteins from the ER and into the blood.
What is the ribosome?
That's wrong.
What is phenylbutyric acid?
That is correct. His winner is Michaela, the comeback kid.